Today's presentation is Understanding Missouri's Prop A, Minimum Wage and Paid Sick Leave. It is presented by a staff member from Ironwood Business Consulting. But before I introduce the program, I want to tell you about a partnership that the Chamber has with Ironwood that you guys can take advantage of as a member of the Chamber. So they are a member of the Chamber, but they specialize in helping employees navigate the complexities of regulatory compliance. So they provide assistance in things like human resources or Department of Transportation, crisis management. Those are a few things that they do. So because you guys are a member of the Blue Springs Chamber at no charge, you have access to them, all of the services that they provide with both telephone and email support from their compliance experts. So again, things like DOT, OSHA, HR, and contractor compliance. So I have personally used their services. Before we rolled out this program to our entire membership, I wanted to test it and see how it worked and make sure it worked well. So I had an HR issue come up that I just wasn't 100% sure what to do. And so I emailed them to see how the process worked. And they responded quickly via email. I set up an appointment with them for the next day. And within about 20 minutes during that phone call, they kind of walked me through the issue. They provided feedback for things that I maybe hadn't thought of and gave me some suggestions. And so then I just had a lot more confidence to deal with that issue appropriately. And again, there is no extra charge for this service. It's something that you receive because you are a member of our chamber. So you can find out more about this by pulling up the chamber's website. It's bluespringschamber.com. You can see there is a for members section. Hopefully you guys can see that. Okay, good deal. So you see the for members and resources is going to bring you to these 4 resources, and Ironwood Business Consulting is what you're looking for. That's going to bring up this page. Like I said, you do have to fill out a 1-page service beneficiary agreement right here. And then this is the list of all of the different things that they can talk to you about. And there's the emails right there of all of the different places to email when you have any questions or concerns. So hopefully you'll feel comfortable taking advantage of that service. And like I said, it worked well for me. So let me go ahead and introduce today's speaker. This session is presented by Emily Dimon. She is with Ironwood Business Consulting. As a human resources coordinator, Emily leverages her business management, customer service, and recruitment expertise to advance her team's professional growth and ensure enlightenment with the company's goals. Her background in the hospitality industry has equipped her to effectively manage and develop a team of 120, fostering a culture of support and productivity. Emily's exceptional service delivery and communication skills, along with her commitment to Ironwood's core values, make her a pivotal figure in promoting a workplace environment where employees feel valued and motivated, thereby driving the company's mission forward. Emily earned a specialty credentials through SHRM in both talent acquisition and workplace investigations. She's SHRM CP certified, a licensed private investigator, and holds a mental health first aid certification. Emily lives in St. Louis, and we're very happy to have her here today. So Emily, I'm going to let you take it away.
Amazing. Thank you so much for that introduction. I do have a few housekeeping items if you want to jump to the next slide. And I just wanted to put out the disclaimer that any of this content in this training is just offered general guidance based off of current laws and best practices. So we're always going to set you guys up for success in the best ways that we can, but just know that all federal, state, and local regulations are subject to change. And then you can go to the next slide, please. With that being said, this is being recorded. I think you guys were prompted in the beginning, but just be mindful if anything comes up, you come off camera or you drop anything in chat, it is being recorded. So we just wanted to put that disclaimer out there. So as far as our agenda, we're going to cover Missouri minimum wage increases, Missouri paid sick leave, which is going to be the hot button that we're talking about, compliance requirements, and then the legal and legislative challenges within. So to kick us off, there's a little bit of background I wanted to go over. So Missouri Proposition A was a citizen-driven ballot, meaning it was placed on the ballot after a petition drive secured the required number of signatures. So the initiative was officially certified for the 2024 election, which voters approved with 57.5% of the vote, showing strong public support. So Missouri's urban and suburban areas largely supported this measure. And the approvals reflect a growing trend in the US where states have increased minimum wages and expanded worker protections through direct democracy rather than relying on legislative action. So some key workforce issues that led to this initiative, we had inflationary pressures where workers were struggling to keep up with the rising costs of living. We also had worker advocacy groups, meaning unions and labor rights organizations push for stronger protections for their employees. And then obviously public health concerns. We're still dealing with ramifications from COVID-19, and just the pandemic highlighted the need for paid sick leave policies to prevent workers from choosing between their health and their income. You can go to the next slide, please. And then from there, Prop A aligns Missouri's labor policies more closely with those in the neighboring states. So, for example, Illinois has a 15-hour minimum wage as of 2025 already. And they also enacted a Paid Leave for All Workers Act in 2024, which is providing similar provisions as Missouri Prop A. Arkansas has index minimum wage system that adjusts annually, which we'll hit on kind of how that works, because that is what Missouri will be focusing on in 2026. And then Kansas still allows for federal minimum wage of $7.25. So that's just making Missouri's increase notable shift in the regional wage standards and just kind of making them an outlier, if you will, making Missouri that outlier. You can go to the next slide. Thank you. And then as far as just diving in, so that was a little bit of a background, but I wanted to hit on minimum wage increase first. So Missouri Proposition A marks the third minimum wage increase since 2006, the other year being 2018, and then now 2025. So we should have already seen that increase for the $13.75 per hour. If that is something that your company is not following, please reach out to Ironwood and we'll help you navigate those waters. But come 2026, January 1st, there's going to be a further increase to that 15 per hour. And then post 2026, that's where we're going to be focusing on annual adjustments based on the Consumer Price Index. So for those that do not know, the Consumer Price Index is a measure that tracks change and the average price of goods and services over time. And so basically those changes are in what's called like a market basket. And those goods and services being tracked would be housing, rent, utilities, home prices, food and beverages, transportation. So that's going to include gas, public transit, car prices, and then we have healthcare as well as education and childcare, and then recreation and entertainment. And basically the U.S. Bureau of Labor Statistics, also you will commonly hear BLS, they collect this data monthly that will determine the Consumer Price Index, the CPI. And so essentially as the CPI fluctuates, we will come post 26 increase minimum wage to fluctuate with it. You can go to the next slide. And then from there, this is where the fun one starts. So for paid sick leave provisions, for this is going to apply to full-time, part-time, temporary workers are eligible for 1 hour of paid sick leave for every 30 hours worked upon hire. So that means they do not have to wait to start accruing. With that said, there is small business versus large business variation. So if you're a small business, that's going to be considered under 15 employees. And if you're a large business, that's going to be considered 15 or more employees. And so basically, if you're a small business, employees can accrue or use up to 40 hours per year. And then large businesses are going to be that 56 hours per year that can be used for the earned time. With that being said, you might be questioning, how does that year start? So for the year, for the purposes of Prop A's earned sick time, is accrued and expanded in any regular or consecutive 12-month period that the employer chooses. For example, an employer may choose their earned paid sick time benefit year to be accounted for from May to April. Since the specific paid leave provisions are hitting in May, likely your company is going to follow May to April just to keep things simplified, which is something that we were actually discussing before we all kind of joined on for this, was just how crazy it is that this is starting in the middle of the year. Ironwood has navigated some other states going through the same thing. New Mexico, for example, they also started in the middle of the year when they were implementing all their paid sick leave provisions. So it's just kind of crazy how that goes. But essentially, you can choose that 12-month period of what you want that to fall through. So basically, a simple explanation for considering the employees can use up to the 40 or the 56 per year, and then they can use unused earned paid sick time and carry up over to 80 hours. So what that basically means is if you work 30 hours, you'll get 1 hour of paid sick leave. If you work 60 hours, you get 2 hours of paid sick leave. 120 hours, you'll get 4 hours, and so on and so forth. And so basically, if you don't use all your paid sick leave, up to 80 hours can roll over into the next year. So if you earn 56 hours of paid sick leave this year, but only use 20, then that means 36 hours will automatically roll over into the next year. You can, or I guess another way to look at it is if you think of it like a bucket. So if you already have 80 hours saved, then you won't earn more paid sick leave to roll over into that new year. With this being said, what kind of makes it a little bit more confusing and another interesting caveat is you do have a usage hour cap, meaning that 40 hours if you're a small business or 56 for large, but there's not an accrual cap. So just because they're hitting that 40 hours or that 56 hours does not automatically mean that the employee is not accruing time still. So that's where that carryover is going to come into play as well. And then to further that, employers are not required to pay out sick leave unless your policy chooses to do so. Ironwood, we navigate that a lot where employers just want to add that extra employee benefit, or maybe it's competitive at that point for them to offer pay out for sick leave. So you could run it that way if you choose, but you definitely do not have to. Same with if you want to pay out that employee upon termination or separation, that is also up to you. But the most important part with that is you have it written in a policy and it applies to all employees, and it's not used per case situations. With that said, you might be questioning, okay, what if I already have a policy in place and then now this is being enacted? So come May 1st is when we all need to be compliant following Missouri paid sick leave. So if you have current PTO policies or vacation, if your policy meets or exceeds Missouri's paid sick leave provisions, you're not required to offer additional paid sick leave. So you don't necessarily need to run your PTO policy and a separate sick leave. But that's where it does get kind of confusing and what we often help our clients navigate through. What's constituting PTO versus vacation versus sick leave. Again, you can roll it up under one policy and have it hit all, as long as you meet the requirements for accrual rate and usage purposes and conditions, which we'll hit on here next. But as long as you're meeting those, you can have one policy, or you could have separate PTO, separate vacation, separate sick leave. So it's going to be dependent on how you want to do it. For example, Ironwood, we do, which obviously might be changing with Missouri because I reside in Missouri as well as Kyle. And then we have another gal as well. Most of our consultants live in Texas. But with that said, we have a PTO / vacation, and then we have sick leave. So they kind of run separately and what those hours are. And then there's the option for front loading as well, which we will get to next. So you can go to the next slide. Thank you. So as far as the employees and the usage hours and what they can be applied to, it would end up being for employees' own health needs, the family members' health needs, domestic violence, sexual assault, or stalking related issues, or public health and workplace safety related absences. So it can be for the employee's own health needs, such as preventative care. So you have their doctor's appointments, dentist appointments, things alike. It could be for their own mental health or their own sickness that they're going through. The biggest thing with this is you cannot require a doctor's note unless that absence is going to exceed 3 consecutive days. So that's another interesting caveat. So employees could just be calling in that one shift, and then they're saying they're sick, and then you count their hours as sick leave, and then that's that. So definitely opens up the door for how do you question if they're misusing their sick leave. So that's something that employers are needing to balance appropriately to avoid discrimination claims and things alike. So typically that's where, if it's going to be 3 consecutive days, is when that doctor's note needs to come into play, unless it's a emergency. And then family members' health kind of apply to the same thing: their own sickness, illness, preventative care, and then domestic violence, sexual assault, or stalking related issues. A lot of the times this does need to get to the point of it being on record with the police department or some sort of, I lost my train of thought, some sort of record that this has been reported. So that way they can navigate that a little bit more. There's the documentation to provide the proof, essentially. And then public health and workplace safety related concerns. Obviously, this is going to come down to anything that has to do with, if it was a pandemic, hopefully that never happens again. And it could be, school shutdowns, things like that, snow, etc. You might be questioning as well what qualifies as a family member. So this is under these provisions: a parent's step parent, legal guardian, or individual who served as a parent for the employee or their spouse. A spouse would be domestic partner, individual with whom the employee is romantic relationship, grandparent, grandchild, or sibling of the employee, employee spouse, or domestic partner, or a person whom the employee is responsible for providing health or safety related care. Is kind of how that falls in line. If your company qualifies or is eligible for family medical leave, it follows similar provisions as what's qualified as a family member as those. You can go to the next slide. Thank you. So with that said, Missouri Prop A does have some exemptions. So if we're looking at the public sector, it's going to be educational institutes, governmental entities, political subdivisions, school districts. And then if we're looking at the private sector, retail and service businesses with less than 500,000 in annual gross sales. So these are going to be exempt from Missouri Prop A, meaning that they're not going to need to initiate the paid sick leave. And some of these entities may not need to actually follow the Missouri minimum wage increase. So pay attention to those if you fall in line with one of those. I don't want to dive in too much on this. So if you guys have any questions, please feel free to reach out to Ironwood, and we're happy to help navigate these. But the biggest one's going to be that retail and service businesses with less than that 500,000. As we all probably can assume, Prop A is for small businesses. It could mean big things in the sense of not being able to keep up with labor costs and things, which we'll end up hitting on. So that 500,000 threshold could be a game changer for those smaller businesses like that. You can go to the next slide. All right, so tracking hours. So 1 hour of paid sick leave for every 30 hours worked. So an example calculation I have up here would be for full-time employees, so 40 hours per week. You would take 40 hours divided by the 30 hours worked, and that would equate to 1.33 hours of paid sick leave accrued per week, which would be roughly 5.3 hours per month, which would be then applied to 56 hours per year for larger employees, or the 40 hours for smaller employers. And then part-time, you do the same thing. So if they work 20 hours per week, you would then divide that by the 30 hours worked, which would get you that 0.67 hours of paid sick leave accrued per week, which would equal or equate to roughly 2.67 hours per month. And then this accrual is proportional to actual hours worked. And then you might be wondering, how do salaried employees come into play? So under the Fair Labor Standards Act, when you are taking exempt employees into consideration, they are assumed to work 40 hours each work week unless their normal work week is less than 40 hours, at which you'll follow one of these calculations. Otherwise, you're just going to follow that 40 hours divided by the 30 to get the 1.3. And that is how that is equated. And then with that, you might also be questioning, how do you calculate paid sick leave for employees that might receive tips or gratuities? So the tips shall be paid either their regular pay rate or the state minimum wage, whichever's higher, and then the tips cannot be deducted from that pay. So if they are higher, or at minimum wage, you're going to choose whichever is higher and then do the calculation. Again, this is a pretty high level way of going about it. Again, reach out to Ironwood. We're happy to help navigate this. Because another way that you could also do it would be to front load hours. If you want to go to the next slide, which would be accruing, instead of accruing per hour, you could just have your employees front loaded all of the hours at the start of the year. So if you're starting in May, you could just say all of your employees get the 40 hours for small businesses or 56 hours for large, and then run forward that way. It does have benefits just as much as drawbacks. So it does simplify record keeping where there's no need to track accrual per pay period. But that's not to misconstrue that because there is a accrual usage cap, there is not an accrual cap. I said that backwards, I think. So there's a usage cap, but there's not an accrual cap. So you're going to have that 40 or 56 hours capped, but that does not mean that they could stop potentially accruing. So I just saw a question pop up because I was kind of getting there. What would be the purpose of rolling over if you have that cap? So basically that cap is going to so you have the 40 or the 56 cap, and then since there's not all right, let me pause. You have either the 40 hours for use for small employers or 56 for use for large employers. And so that's going to be your yearly cap for what can be used. But that doesn't mean that the accrual stops for those employees. So you'll need to be calculating the accrual from there. So again, it's going to come along the lines of if you work the 30 hours, you get the 1 hour of paid sick leave. If you get the so on and so forth. And then from there, anything that's going to exceed that 56 hours or the 40 hours, that's what you'll still want to be tracking, which will then be the rollover. So if you have that employee that works we'll just say they get 56 hours, but they only use the 20, then the 36 will roll over. Or if you have the employee that uses all 56, but they still accrued because they met that usage cap already, then that accrual part will roll over. So it does have its drawbacks in the sense that, if you do front load all of the hours up front, then you could potentially have those employees that start and then they use all of their sick leave and then they quit or something like that. So that's always a risk that you run with front loading. But again, it does kind of simplify record keeping in that sense. And then it's easier for employees to know their total available hours as well. For example, like I said, Ironwood front loads ours. So I know automatically we have X amount starting each year. Easier from an employee standpoint to be able to track my hours so I know what I have coming up to use toward vacation, doctor's appointments, etc. You can go to the next slide. And then some tracking methods. So best for small businesses, which technically per this, it's going to be that 1 to 15. You could use spreadsheets, so it could be Excel or Google Sheets. And then you'll want to track weekly hours worked and sick leave earned, and then log sick leave used and remaining balances. And you'll want to maintain time off requests for these records. With that being said, if you are tech savvy, you can have all your formulas and all the things doing exactly what you need it to do. So that way, when you input the hours, it'll export the next thing for what sick leave is accrued and things like that. So you can definitely go about it in that way. And then we also have the options for if you are a mid to large employer, you could have a payroll and HR software, which will then automate accrual calculations, paid sick leave integration to pay stubs and time tracking, compliance reports for audits. Sometimes some of these platforms offer audits, and you can keep up with ensuring that you are within regulations and that everything is tracking accordingly. And then employees can check balances through the self-service portal. So Ironwood, we use Bamboo HR, but there's also Workday, ADP. There's a bunch of different platforms out there. Of course, this is going to be more cost effective or it's going to be more costly, but it could be more effective in order tracking and simplify the process. And then there's also time and attendance systems for this would be for like hourly to shift-based workforces. So you can have employees clock in and clock out, and then the paid sick leave will automatically accrue from there. And then some examples of what those methods could be. There's T-sheets out there by QuickBooks. There's also Kronos, Time Clock, and Clockify. Time Clock Plus, and I believe is paid, but Time Clock might not be. But there's versions out there. I know the DOL also has, or Department of Labor also has platforms out there that they have like a whole time tracking app. I don't know if it's going to get as granular as paid sick leave and stuff, but it might be worth looking into if you don't have something set up in place already. Because I know employees can track their own time through there as well. So if you have like reporting mechanisms for the employee tracking their time, they turn that in at the end of the week, things like that. With that being said, it's very important that with paid sick leave provisions that all members of management are trained to understand what that needs to look like as far as reporting compliance goes, which we'll get into. You can go to the next slide. Thank you. So basically this, I kind of want to dump into the scope of the impact of what all of this is going to mean. So for workers that are affected, 67,000 is what the projection is. And this would include employees working at or near minimum wage and those who currently lack paid sick leave benefits. Many of these workers are industries like retail, hospitality, food service, healthcare support, maybe childcare. And so basically workers earning below the new minimum wage will receive the pay increase and then improve their standard of living, which will then turn to employees previously forced to take unpaid sick leave will now have protected paid leave. And then workers may experience lower job turnover as improved benefits make jobs more sustainable and attractive. And then we have the 25% of Missouri's workforce affected, which is a very large percentage, a whole quarter, that will be directly affected. And many more will see indirect impacts as wage floors rise and paid leaves shift. So as entry level and lower paid jobs increase in wages, other workers in similar industries may see wage adjustments to maintain fair pay differentials. As you know, if you need to have specific jobs increase in pay, you might need to be paying attention to how that pay structure might be for the rest of your company as well. Businesses that already offer paid sick leave may need to obviously revise their policies to meet these statements, which we'll end up discussing. But most industries affected for that 25% of Missouri's workforce, again, is going to be the retail and hospitality, healthcare, food service. Employees in the restaurant and food service will benefit from both of these. My background, as we've heard, is restaurants. I dedicated almost 12 years of my life within the restaurant industry. And I ended up running a location that was extremely successful for what we were doing. And Kyle and I, we actually used to work together in that said restaurant before we both joined Ironwood. But we were discussing last night how crazy it is. Just we could think of 5 different things automatically that need to change within the restaurant industry that's going to then impact policies, procedures, and all of the fun things. So it's definitely going to have a long-term impact in that sense. And then 60% of the affected are women. And this is because women make up a larger percentage of low-wage and part-time workers in Missouri. Many women work in sectors that are impacted. So again, healthcare, education, child support, retail, food service. And then women are more likely to be the primary caregivers, so making paid sick leave critical for balancing work and family responsibilities. So again, that's tying it into the push for this act or this proposition, if you will. And then as the others, if now women will have more financial stability, greater job security, healthier work environments, and then long-term effects of the workforce would be that it would make employment more sustainable, the turnover rates will be less, and then even so, to further that, women would also be reducing the dependency on public assistance programs because they're able to get back in work or actually afford their livelihood, if you will, with the minimum wage increase. And then 86% of those affected are from low income families. So these are families earning at or near the poverty line, which is typically making less than 35,000 per year. And then, so with that said, many cannot afford to take time off work. So this is another push of why the proposition took place. And so basically, obviously we can reiterate things that I've already been saying, but with the low income families, they will now hopefully experience less income loss with the paid sick leave taking over, higher wages to improve that financial stability, and then obviously healthier children and families throughout as they can care for their children and so on and so forth. And you can go to the next slide. Economic impact on workers. So basically what this one means is from 2004 to 2006, since we're going to see that $15 increase, this is going to add $5,616 annually to each employee. So it'll make workers with more disposable income. So leaving that for housing, food, healthcare, transportation. But you're also seeing that number and probably thinking that company-wide, that is a big jump when it comes to costs of labor and how you're going to make that happen, which again, we'll talk about. And then poverty reduction, kind of already hit on this one a little bit, but if that poverty line is going to be at that 35,000, essentially what this Prop A is going to allow for is that increase of poverty. Right now, the percentage is 12.7% of people, which is like 750,000 in Missouri that are in poverty. So basically with Prop A, the hope is that it will get to 10% due to increases of wages and economic stimulation. You can go to the next. Some of these I'm speaking through. So this one, Missouri is the 5th highest minimum wage in the United States, which is comparable to New Jersey, Connecticut, California, and Washington. So come 2026, we're going to be at that $15 mark, which would put us in line with these, Washington being the highest. And again, falling in line with the neighboring states of Missouri. I think that's very interesting to think about when Arkansas is still at whatever the federal minimum wage is, 7.25, something like that. I forgot the number. Which is probably a good thing. That means that minimum wage is higher for my company. But with that being said, I just thought it was good introspect of seeing the comparison here. You can go to the next slide. And then challenges for employers. So increased labor costs, reducing hours and staffing, and then updated payroll systems. So obviously, as we see the increase in minimum wage, employers must budget for a higher base pay rate, particularly in industries with a higher percentage of minimum wage workers. So employers must allow employees to accrue, and then this will result in additional labor costs. Something that Kyle and I were talking about last night when we were discussing all of these things, especially in the restaurant industry, or just really any company. It was crazy that we had the full picture moment of, okay, we have an employee call in that uses their sick leave, and then now we have to pay them their sick leave, but then we still have to potentially pay for their replacement if we're capable of bringing somebody in. And then that right there, you're paying double for one position. So the increased labor cost is going to definitely add to, especially when it comes to small businesses. And it's definitely going to be affected, which is a big push of why we are in legal challenges right now. Just for the purpose of time, I think we can understand the reduction in hours and staffing. If we're going to need to have increased labor costs, we might need to reduce in staffing so we can then have higher base rates and things like that. And then updating payroll systems, that's going to be costly, time effective. Even if you are implementing spreadsheets, that may not actually cost anything additionally. Just the manual man hours, if you will, on learning that and making sure it's appropriate and working and keeping up with it and all the things. So just some things to consider. You can go to the next slide. Thank you. So benefits for employers. So increased retention, which then reduces turnover, right? So that's some things that we can be hopeful for as these changes take place, as well as just improved health overall. Employees aren't going to need to place income over their health, which will then have productivity overall with hopefully minimizing burnout, which again will increase your retention, which will again reduce turnover. So it's a big cycle. And then hopefully you should see those pretty effectively pretty soon, especially when you're hiring. You're going to be able to offer more competitive because we now have paid sick leave to offer. Most of the industries that don't offer paid sick leave, such as restaurant, healthcare, childcare, educationally, basically this will now be a selling point that you now offer it and it is there. And then, you know, as a company, you can choose to exceed the minimum requirements or you can meet them. You can even offer extras and things like that. So definitely a larger conversation, which then is going to lead us into the legal challenges. So you can switch sides. Thank you. So right now, Missouri Prop A has been okay. So Missouri Chamber of Commerce and Industry. There's also Associated Industries of Missouri, Missouri for Forest Products Association, Missouri Grocers Association, and there's also a couple more that are on that have basically filed a lawsuit and could potentially cause change into what we're talking about today. If you are familiar with the Fair Labor Standard Act and all of the things that were taking place last year, and we're a month out from initiating all the changes, and then it just ended. And we didn't have to actually subject all of those changes that we planned for. So there is potential of that happening. If you want to go to the next slide, because the single subject rule, essentially what that means is the Missouri Constitution mandates that the ballot initiatives must focus on a single subject to prevent voter confusion and the passage of unrelated provisions bundled together. So since Prop A is initiating Missouri minimum wage increase as well as paid sick leave, the companies and the people that I mentioned previously, they have filed a lawsuit saying that it is unconstitutional to be pushing forward a proposition that is focusing on two subjects. There's also misleading fiscal summaries. So basically ballot measures in Missouri are accompanied by fiscal summaries that estimate their financial impact on state and local governments, ensuring voters are informed about potential economic crises. So with this, there was misleading information that came about from that. And then just overall equal protection concerns. So these three things are what is being challenged currently. The outcome of these legal challenges will critically influence the future of wage and sick leave policies in Missouri. So it's definitely going to be important to stay informed. And you can go to the next slide. So this one just very briefly on types of challenges. So right now we can fully overturn Prop A. We could also have it initiate into a partial implementation or full implementation. There's also things where we can just modify the law, where no voter approval is required. So all of these are going to have legal and legislative aspects that need to be met, and it can be timely. With that said, they could also just modify what's being in place. But then there is legality that needs to take place from that with 2/3 votes, and there's different things that fall into that. But basically wanted to display the fact that it's not just as simple as just saying no more. There are different parts and things that come into play. You can go to the next. So with this said, kind of to wrap up the economic projections. So the states, the GDP. So basically, this is meaning that if there are higher wages, increase consumer spending, which would then improve productivity and health, which would have lower employee turnover, and then higher business costs will equal price increases, which then could have potential job cuts and automation, et cetera, especially as we see AI come about and things like that. So just keeping in mind, again, just like a simple little recap there. Yep, you can go to the next slide. Thank you. I saw your mouse go. And then there's some long-term projections. So again, increased automation, job market shifts, and then small business viability. The biggest one and the biggest push of why it is trying to be overturned right now is that small business viability. Again, if there's going to be costly change, most small businesses may not be able to comply, especially if it's going to be like a smaller restaurant or small maybe clothing store or anything like that. As job market shifts and it's all a cycle. And that is what we need to be focusing on, long-term projection wise though, and how that shapes out. You can go to the next slide. So prep for this implementation. So assuming nothing changes as of right now, even if all the legal challenges are being faced right now, I think some things will be voting on. I think some things were being voted on last Friday even. So even though all of that is in place, if we don't hear any updates, everything still moves forward with Prop A. So in order to prep for that, you're going to want to update any sort of payroll systems and have that in mind. Adjust budgets and things accordingly. Again, pay attention to your pay structure and what that might look like from position to position. And then communicate these changes to employees, which we'll hit on here in a second. You can go to the next slide. So you'll want to revise handbooks. Ironwood, I do want to insert here, we offer an additional service of writing handbooks or maybe just simple policies. So you can keep us in mind as you guys discuss internally the next steps. You also will need to be creating tracking systems. And then there's notice requirements in place. And then the biggest thing that you can do that will always be helpful is to train all managers or anybody that's going to be overseeing the paid sick leave or any sort of increase. Doesn't necessarily need to be managers per se, maybe just a supervisor or a shift lead or somebody that's going to be paying attention to these kind of things. But training them and making sure they are understanding of the policies in place and all of the things to be paid attention to, which then leads me into the next slide of the notification requirements. So written notice of the earned paid sick time policy must be provided to employees by April 15th. So that is a quick turnaround time. I did copy and paste this specific paragraph here from Missouri Department of Labor. So on a single piece of 8.5 by 11 paper and no less than 14-point font, which I think is hilarious to me, but we got to follow by that to stay compliant. Employees, you need to mention the following which employees accrue paid sick leave at 1 hour earned for every 30 hours worked. Employees are prohibited from taking retaliatory action, meaning that employees are allowed to use their sick leave and you cannot question that. You have to allow for it. You cannot take retaliatory action in the sense of because so-and-so uses their sick leave, but employee B doesn't, that employee B gets the promotions and the pay raises and all the things. So just keep that in mind. No retaliatory action can be taken. Employees have the right to bring civil action if paid sick leave is denied, and then the contact information for the department. So all of that will need to be in the notice. And then you'll want to give a good plan of action for new hires. Any sort of paid sick leave notice at the time of hire, so within their offer letter or any onboarding paperwork. And then for current employees, a good practice would be to provide this written copy of the notice within their employee handbook, or employees or printed out notice, be on the posted somewhere visible, a water cooler, break room kind of thing, or any payroll portal upload, or if you have like an HRS system that sends messages or something that employees can access to see these things. You can go to the next slide. And then the workplace posting is going to be a requirement as well. So all Missouri employers must post the paid sick leave notice in a visible location at the workplace. And again, it's going to outline similar things as the written notice to employees. And then the Missouri Department of Labor will provide a standardized paid sick leave poster before April of 2005. So just pay attention to their website for that one. You can go to the next. Thank you. Employee communication. It's going to be important to explain rights and new policies as you are updating them. So again, that notice requirement is explaining their rights, any new policies that will be implemented. Hopefully you have a procedure when you update employee handbooks and things alike on how to get that information to the employees. Implement effective training so employees understand how to use their sick leave and the usage requirements and how the employee can request time off, and then any regular updates that may come into play. And you can go to the next. And then ongoing employee paid sick leave balance notification. So it is required that each employee understands their remaining balance and have that be provided on a pay stub or within their payroll system. And then employees need to be able to ask their balance at any time, and the employer must provide it promptly. Obviously, you probably wouldn't know it off the top of your head, but you would need to get back to that employee within a reasonable time frame of how many hours they have remaining. And you can go to the next slide. And then compliance monitoring. As anything within the HR realm and just business in general, regular audits are going to be your best friend when making sure that we're staying compliant with all the processes and procedures in place. And it will also give you the opportunity to double check and make sure that regulations didn't update. And then you'll want to ensure your accrual is being applied appropriately. So it's always good to have a checks and balances when it comes to your tracking method. And then obviously staying informed through newsletters, Department of Labor website for Missouri, and just federally, and anything alike that might be beneficial. Keeping Ironwood on your back corner will also be helpful as well. You can go to the next slide. So when it comes to record keeping for sick leave, employers must track and retain the following. So employee sick leave and accrual usage. So it's going to break down into hours worked, sick leave hours earned based on the accrual rate, and then sick leave hours used in the with the corresponding dates, and then sick leave balance remaining after each. So this will be helpful when you have, if you have the requests off sheets and things like that. But also need to list sick leave carryover and payout records. So the number of unused sick leave hours carried over to the next year, which again is going to be that 80 hours. And then if applicable, again, you can choose if you pay out your employees or not, but this will also need to be tracked as well. You can go to the next slide. And then under Missouri Prop A, again, you'll need to also keep track of employee requests and employer responses. So sick leave requests submitted, and then approval or denial of these and the reason if applicable. Always, I'm sure we all here document everything. So making sure that if you're denying something, you have a good reason with documentation to support said reason. But again, if they're calling in with sick leave, they are allowed to use it. There can be reporting requirements in the sense of if it's not an emergency, you can require that the employee call in 2 hours before their shift or 4 hours, or however you have that policy set. But it's important that they're still granted the leave. And then you'll also need to keep track of the notice to employees. So any and all that go out from that April 15th notice, you'll want to keep track of those as well for your documentation needs for record keeping. And then employee payroll records, so wage rates and sick leave compensation details, payroll adjustments made for these and things like that. Basically just tracking anything and everything along the way. And then the next slide. And then some good record keeping practices. Ensure all departments and locations follow the same tracking method. So standardized reporting, again, regular audits, and then have that employee communication if they're going to call in, making sure that we're keeping everything documented so you can recognize trends, and then confidentiality throughout. And then as far as the record keeping, I don't know if I actually said this, you need to keep these records for up to 3 years.